About an hour and a half north of Sacramento, right off the 5 freeway, is Glenn County. And if you're familiar with it, you know that this is a farming community. But they're about to lose their only hospital. Welcome to Willows, a rural Northern California farming community in Glenn County. Like many rural communities, their hospital, Glenn Medical Center, is no stranger to struggle.
Rural healthcare is a different animal. And I say that because we struggle with the lack of resources. And what that means is that we build resilience.
And that struggle is about to get even harder. Glenn Medical Center, the only hospital in the county, is closing.
So unfortunately, this was something that was done to us. We had not a lot of say in this matter. This was a CMS decision, the Center for Medicaid Services.
After 24 years serving the community, Glenn Medical Center lost a key federal designation. Under the Centers for Medicaid Services critical access rules, hospitals must be at least 35 miles apart to qualify for certain federal funding. Glenn Medical is just 32 miles from its nearest neighbor, Colusa Medical Center. Liz says they've tried talking to the agency run by Dr. Oz.
They are essentially measuring them off of Google Maps and saying the primary road says you are 32 miles, not 35. And so we try to tell them that is not the road that the ambulances take. That is the road that is often flooded. That is the road that our employees don't take, our patients don't take. It didn't matter.
How much of your budget depends on Medicaid and Medicare funding?
It would be a 40% cut. We would not be able to stay open without this.
Why do you think this is happening now?
They are just deciding to crack down on things. CMS has decided to look at all hospitals all across the country. With the cuts that are coming down from administration, we were just one of the first.
What do you mean by that?
So we actually asked CMS, if you are going to hold us to these guidelines, what about all of the other hospitals that do not meet these guidelines? And their response was that they too will be getting a letter at some point soon.
According to Glenn Medical, Glenn County already ranks near the bottom in California for healthcare access and outcomes, including one of the state's highest cancer death rates. One of the first departments set to close at Glenn Medical Center, the emergency room. The emergency department is set to close September 30th. Once the ER shuts down, the rest of the hospital is expected to follow.
Our clinics will remain open in this building for at least a year. Our medical records will remain in this building for at least a year. So you can still request your medical records you can still talk to the building department. What you cannot do is get emergency services.
For many Glenn County residents, the nearest hospital will now be a 30 to 40-minute drive. That's a serious challenge in a community with a growing senior population, high poverty, and limited transportation.
If you have a heart attack, if you have a stroke, anything like that, it's 30 to 40 minutes away. And with our ambulances being so limited, it's going to be a struggle.
Rural hospitals that shut down can also bring job losses, drive families away, and make it harder to attract new doctors or businesses. This summer, Glenn Medical Hospital administrators flew to Washington, D.C. to meet with Dr. Oz and CMS officials, but
they arrived and the appointment was canceled within 30 minutes of the actual appointment time. They were told that CMS had everything that they needed to make a decision, and that was it. Now, I am told that our Chief Operations Officer, Amy McKelly, was able to meet with Dr. Oz a few days ago, but that the outcome did not change.
We're doing everything we can because we don't want to lose that. I've been a longtime advocate of helping our rural hospitals.
Congressman Doug LaMalfa, who represents the district where Glenn Medical is located, says that he plans to introduce new legislation aimed at keeping the hospital open.
So we're dropping a piece of legislation very soon to change that status for them and put them back into eligibility. Now, we've been trying to urge them don't just close so quick because we're trying to do this. It takes a while to grind this stuff out in Congress and grind out the agencies. The bad thing is once they close the doors completely for 1 minute, then all that eligibility is gone. The mountain is just 10 times harder to climb on that.
What do you think the future of rural health care really looks like, especially under this current administration?
Scary. It's scary. And I say that as someone who works in emergency management and safety, someone who cares about the patient, someone who was raised in this area. It's scary. My family lives in this area, and my father has a history of heart attacks. If something happens to him, and the resources are scarce, and there's no help available, I'm going to lose my father because of something like this. And I'm not the only one feeling that way. That's what all our patients are feeling.
The federal government has now set aside $50 billion specifically for rural hospitals called the Rural Health Transformation Fund. If that were to go through, could that realistically help your hospital, or is it kind of a little too late now?
It's a little too late right now. I hope that it goes through because healthcare needs the assistance right now. But as far as our hospital goes, it would not be quick enough to save us.
If you could talk to the administration directly, is there anything you would like to say to them to keep the hospital open?
We need a miracle. We need an act of Congress.
And Liz wants the community to know.
We did everything within our power. And we're very sorry this was not the outcome that any of us wanted. And we will do everything we possibly can in the future. We remain committed to rural healthcare. We remain invested in this community and your families and our staff. We will always have a heart here.
We reached out to CMS, who confirmed Glenn Medical can no longer be certified as a critical access hospital, but can be certified under another provider type. And that's a decision the hospital and state would have to make.